the show today is Senior Vice President and Chief Medical Officer at Henry Ford Health Jackson and Henry Ford Health, Dr. Mark Smith. Mark, welcome back to the show.
Thank you, Bart.
It's been a minute.
It has.
Yes.
It has. A few years. But appreciate the opportunity to come and represent Jackson as well as Henry Ford. So thank you.
Yeah. And you do represent Jackson. In fact, Mark is homegrown, which I think is pretty cool. Someone that grew up here. You went to Northwest.
Northwest High School, yeah.
And then made his healthcare career right here in Jackson. I know that's something you are encouraging, and you're actually having some success getting local people interested in healthcare locally.
Correct. Yeah, I mean, I always knew I wanted to do something in medicine. My mom was a nurse, and so for me that was, I think, an easy choice. However, other folks, they need to learn about it and understand, what the job actually is. And so that's one of the things that, we're working on as a hospital and a health system, is to try to, get folks excited about healthcare early on even in middle school and high school. And so working with the local schools, working with the colleges, trying to coordinate programs that might get people interested, and then have a future job within the hospital health system here locally to fill some of the gaps that we have. We have quite a few gaps, after the last few years related to technical positions, nurse, assistants, nurses in general. So yeah, we're working pretty hard with the Human Resources Department and the local colleges to get people excited about it.
And you got some help from the Al Glick Foundation, the Glick family, and Alro Steel.
Yeah, there's a huge endowment, and that's just going to be the spearhead for a program that'll probably go on for years and years to come, which is that, currently about 180 scholarships will be offered to folks, a few a year, and getting them tagged into opportunities that we have a need for at the hospital, as well as they're interested in related to a college career. And then they get them in this program, they'll get them educated, and then they will work for us for a few years after that as an obligation for us, helping fulfill their college education.
And they'll like it so much they'll want to finish their whole career out here.
Absolutely, that's the goal, yeah. Keep people local.
I think it's neat that for the most part we have local access to just about every specialty, but you're not exhausting your search for more. No. You want to keep adding. Correct.
Yeah, I mean, obviously we're a full service health system here locally, including open heart and our TAVR program, structural heart. But we also have some basic needs in family medicine, dermatology, some of the surgical subspecialties. We still have them, but they're a little bit lower service than what we've had in the past, and we're on a recruitment effort with Henry Ford Detroit, the Henry Ford Medical Group, MSU relationship, as well as some national searches to try to help find some of these people to bring them to town. We've also, engaged the virtual option, which is actually a neat technology that you can bring specialists from afar into, and you wouldn't have to travel to Detroit or other places to get that, at least the consult done. If you have to have a procedure or there's other treatments that are needed, you would definitely have to travel for those things if we don't do that here locally. But that's the other beautiful thing about our relationship with Henry Ford and MSU, is trying to bring that technology as well as services here locally. But we do have work to do, Bart. That's absolutely true.
And it's not just our community. This is something that all communities are struggling with.
That's right. It's a national problem, yeah. Shortage of physicians and healthcare workers in general. We see the nursing side of it as well during some of the national programs, and they struggle with folks that are wanting to do healthcare, which is why we've strategically partnered with our local community to try to fill those gaps on a long-term strategy.
And right now, if someone needs to secure for their family a family practitioner, you can get an appointment right now.
You can, yep. We have physicians that are taking patients. and not just Henry Ford, right? We have local private physicians that are within our Jackson Health Network, as well as the Center for Family Health and other physicians in the area that can take patients. It's a matter of finding that access and getting that access, and it might not be the exact time you need or want. Folks are pretty particular at times with when they want to be seen. And so we work really well to try to accommodate that as best we can. Some of the specialists, though, are out, 2 to 3 months before we see them, which is why we need to recruit in those areas, because that's not acceptable either. I mean, folks need treatment before that, so yeah.
So we've hopefully come through the winter healthy, but we had people with respiratory things, and I think during winter we see that. How's the hospital right now in terms of, particularly the respiratory issues like COVID?
Yeah, so the hospital is, as of yesterday, today was about 85% occupancy with our bed status. The COVID is really not in the hospital right now. It was we had a few folks in the hospital every day, maybe 4 weeks ago or so, but it's really settled down. A lot of the RSV, the respiratory syncytial virus, as well as the pneumonias and some of the other viruses that winter brings us, those have all settled down as well. And now we're getting into the allergic. Spring is here, the pollen is running around, and so you get a lot of the asthmatics and some of those folks, the COPDers, folks that have chronic obstructive pulmonary disease. Those are things that we're seeing now. But the COVID and the infectious respiratory issues have really settled down, which is wonderful.
Yeah, that's good news, because here we are after 4 years with the pandemic and its aftermath, finally at a point where it's in the rearview mirror.
That's right. I think it'll always be there. It's just like any other virus. It'll mutate and change, and you'll need to get a vaccination related to covering them, but it's not going to cover everything. You still have a chance of getting ill, and you need to have precautions, and just like any other respiratory viruses that are around.
Well, it's not just people's health you have to be concerned about. You also, running a big health campus, have to be concerned about just overall safety.
Sure.
What are some of the things that Henry Ford Health has been doing lately to increase safety at the hospital?
So, obviously, safety for patients as well as staff is a huge priority for us. Even walking across the street, we've had a few injuries there. So, working with the Michigan Department of Transportation on just street crossing, if you can believe that, is definitely one of the priorities for us. However, we also have, changed some of the security licensing that we do. We actually have a police force now at the hospital, as opposed to just security officers. They're security police officers now, and they get that special training. And they're I think graduating. We are up to 8 now of those officers that have that training. We have another K9 unit, so we have 2 K9 units now that are doing rotations around the grounds and whatnot. Aldo and Onyx are their names. And then just, in general, making sure that we have security officers and rounding patterns that are appropriate for the times that we need them. You never can predict, but you can, go by history and where the folks are needed the most. The emergency department obviously is an area that's of high focus 24/7. But we have other areas too, behavioral health areas that need coverage. And just making sure that those areas are covered, our faculty and staff are safe. Patients do get angry at times, and there's lately been some healthcare related injuries that probably wouldn't have been there in the past. So working with also behavior management and some of the de-escalation techniques to try to help people, with their current situation, if you will.
Yeah, well, and plus you've got, like any community, the law enforcement brings in a victim of a crime or someone that was involved in something violent. There's a risk to having those people on.
Absolutely. Yeah, and we have a great relationship with the city and county forces and the sheriff's department. They do a great job and help us, secure folks when we need to. But our priority is their medical care and making sure that all that other legal stuff is sort of secondary. However, sometimes they merge together when there's a mental issue that you can't tell the difference sometimes. And so we have to take precautions and secure folks in a way that's safe for them as well as our staff.
Yeah, I think it's pretty standard as you arrive, particularly in the emergency department. There's a security screening that everybody has to go through, and
Yep.
I guess it's accepted now that this is what happens everywhere where there's a lot of
It
people.
is, yeah. And then, the folks that come in through the ambulance, we also have hand wanding and for weapons detection, because we've had incidences where things have in the past have gotten into the back, and that isn't appropriate, and it's not it's a safety issue. And so for folks that are coming in the front door, those people all have to go through that screening, but we also have ways to screen people that come in through the ambulance or the police department that brings them in.
Yeah, not only do you have the police department officers, you actually have a detective, an investigator as part of the team.
Yeah, so Chandler Cheeks was in the Department of Corrections for years, and we are lucky to have him as far as some of the strategies that we've implemented recently, and a great addition to the team and helping us sort of round out that security police force that we have.
Nice. All right, we're counting on nicer weather. By this weekend it'll warm up again, but we're getting closer to the travel summer vacation season, and there's some needs that increase during this time of year every year.
Yeah, so from a traumatic standpoint, traumatic injuries always increase in the summertime when people are out doing things, recreational things, and there's no way to pin it on exactly one thing, but it's all the fun that we have, right? Sometimes there are injuries related to that. We are a level 2 trauma center, which means we can take care of anything that comes in, stabilize that, but sometimes you need blood when those injuries happen. And so we are having a blood drive that's going to be June 7th, and we have a company that supplies our blood for the state of Michigan, Versity, and I think you have that information that we could post hopefully, but it's the company that's organizing the blood drive. They have donations that they will accept, as well as they will accept your blood if you wish to donate the blood or plasma. And so that blood drive is extremely important. We keep those donations locally for care and how we can manage our people here, because at times we do have shortages of certain types of blood products that need to be given to our trauma patients and other patients that need blood in the hospital.
And versity.com is where or versity.org is where you can go to register, and that's VERSITI.org. And the blood drive that's going to be at the Anderson building will be on June 7th, and we'll remind you again as we get closer to that date. I understand the pink ball this past Saturday night was a big success.
Yeah, it was a really good time, and the donations there and that philanthropic event went to help out with that endowment that the Glick family gave to round out the scholarships. And the more money that was donated, the more scholarships we can offer. And so that was the focus of the pink ball. It was a great event. We had a good turnout and a good fellowship and networking. So thank you for mentioning that.
Yeah, my son Joe and his wife Katie, they ended up winning, I think they went in with another couple, the wheelbarrow of booze.
Oh,
Yes.
very nice.
That's a healthy item to give
It
away.
is, yeah. Hopefully they have friends to help them with that.
They've already, they ended up giving a lot of it away at the pink ball.
Yes.
Unfortunately, they gave some to the busboys, and unfortunately they aren't, 21.
Uh-huh.
So busboys, you might want to just keep that under wraps.
Give it to your parents. That's right.
All right, so a lot going on. We appreciate all that you do and your medical team keeping us safe and keeping our community healthy. Thank you.
Thank you, Bart. Appreciate the opportunity to be here.
Great to see you again.
You too. Have a great day.
Mark Smith, Dr. Mark Smith, Senior Vice President and Chief Medical Officer with Henry Ford Health and Henry Ford Jackson Hospital. One of